right, week 5. Once again, Scott Martis here, going to talk about learning objectives and the course contents for week 5. This week, we're going to try to button it all up, really kind of highlight a lot of the things that now we are going to be responsible for as administrators and managers. Up until this point, I think we've looked a lot at the employees and then us as managers and us, creating a disciplined process and quality assurance and customer service and leadership tactics and management tactics to hopefully positively impact our workforce and allow them to do better, be better, achieve greater things, and meet the objectives of the organization. Well, now the scrutiny is going to be on us, right? Because the whole organization objectives is based essentially in a code of conduct or a code of ethics. And I know that when we deal with some level of reimbursements and even in the for-profit sector, I think people are always like, well, it's all about the money in it. And it's all, it's they only care about the bottom line. And there's obviously an aspect to that, right? We need to care about the bottom line. But when we look at an industry that was started in the 60s, as far as, the more common industry that we know, it was based on paying somebody for performing the service. It's aligned with all of U.S. healthcare, which is a fee-for-service model, as we discussed in one of the previous weeks. We provide the service, they pay the fee. That's based in reimbursement, and that triggers a lot of for-profit activity. It doesn't necessarily mean it's bad, right? It doesn't mean it's unethical. It just means that the drivers are going to be a little bit different. And newsflash, even our nonprofits operate on a margin or attempt to operate on a margin. Now, they may choose to reinvest that margin into the industry in 100% capacity, but ultimately you have to turn a profit or you're not going to be functioning effectively. For the EMS agencies that are nonprofit, specifically our fire rescue based, our county based, our municipal based, even some of our third service, you still need to create a margin too, because if there's a reimbursement capturable there for your service, the municipality is going to question why you're not bringing that in. So everybody should have a code of conduct, a code of ethics, a code of standards, and that's got to be laid out from the administration of the organization. What do we stand for? What are we trying to accomplish? Do we have a vision and a mission statement? Do those visions and mission statement that highlight what our values are as an organization, do they then get presented to the street? And that's usually our biggest problem, right? We have a mission or a vision statement, but then our officers or our supervisors, our field level providers that are responsible, our FTOs, anybody that's in a leadership, whether it's formalized or informalized role in our organization, isn't adhering to that values and that mission statement. So you wonder, where did they get from that? Where did that come from? Is that from the administration on down, or we just have poor hiring processes? And those are things that we need to look at, right? We need to identify what those issues are so that we can move forward in a constructive manner, because they're only going to get more challenged. We look at the future, the technological advances, like our mission statement, our values, our ethics as an organization now are going to have a positive or a negative effect as we move to future developments and future growth, right? Technological advances is one of the things that talks about future growth. Budgetary concerns could be something that talks about negatives. I happen to be recording this in a time when there's great palpable political change in the country, and there's different ideas that are starting to make headways. There's different coalitions amongst political parties, and nobody knows what that's going to mean. It could be fantastic. It could be terrible. We have no idea, but we know that the shift in how we look at things like budget and funding is going to change. It's going to adjust, and that's going to adversely affect us or positively affect us. But our mission statement should remain the same, whatever that value mission statement is. And we'll let the important deciders of the grand poobahs that run our organization decide what the outcome is. But we still need to hold, and that's going to be tough. It's going to be tough to communicate that. So when we look at how we keep our code of ethics and we want to create it, we're what is a code of ethics? Well, number one, it's a framework for our behavior. So as we were talking about our objectives, it's the overall behavior of everybody in the organization. It's not just the organization as we know it, as the individuals know it in the from a disciplinarian sense. It's take paramedic A out of the seat and replace that person with paramedic C. And that's the framework for the behavior of the organization. This is what's expected of you. It promotes accountability forever, for everyone. This is our ethics. This is how we operate. This is what we're expected to do. All right. If it's on page 1 of the employee manual and I don't have to search to page 57, then it's very easy for me to say, in a discipline setting, you did X, Y, and Z, and that violates our code of ethics. Now, were you unaware of our ethical code? Were you unknowing, unwilling, unable? We need to figure this out, right? Sometimes your behavior just doesn't present well to the organization, and we want to make sure that that's spelled out so they understand. And then we want to put in a position to foster ethical practice. Well, what does that mean? I'm fostering ethical practices, right? Well, that's easy. It means you don't promote a supervisor that runs around and sexually harasses employees if you're then going to discipline employees for sexually harassing coworkers, right? You don't go after somebody for dogged calls if your supervisors aren't doing calls. You don't you make sure your supervisors are checking their equipment. The managers are checking their equipment. If you expect your employees to be attired effectively and have a good customer service relationship, then that means you are accountable to that because it's in the code of ethics, right? That's what fosters this behavior, right? And that's going to help us as we have, like I said just before, these changing demographics of the United States, as we get more diversified, as we're truly the melting pot. One of the things that's been cracking me up lately is the ancestry, and nobody has any idea. We're all lost. Nobody knows where they come from anymore, which is great, right? We're just a big melting pot of cultures. Here I am. I'm a New Haven area, Irish, German, Scottish, British guy, yet I make sauce and I say tree instead of three. So it's really a great diversification, and we're going to see that continuous changing demographic. It's our ethics that are going to ground us for that. If the technology takes away from our ability, if we start to become compliant, reliant rather on technology, and it takes away our ability to actually care for our patients, it's our ethics that's going to bring us back into that component. And then our societal expectations, right? Obviously we're EMS. I don't see a big issue, but we want to perform in the best interest of the patient, regardless of what the societal expectations may be, right? Somebody said true democracy is two pigs, or two wolves and a pig deciding what's for dinner. So when you're looking at these things, sometimes pop culture, the popular culture, the flavor of the day could push somebody towards operating outside of the code of ethics of the organization. So it's important that the code of ethics of the organization take what the true mission is and create that statement as it moves forward. And then we look at what helps keep us accountable. And so where is the place for the government oversight, and how what is it, who's holding them accountable, but what are we there for, right? How about accountability for us and transparency? In Connecticut, there's always a big argument about the patient service area responder. It's consistently coming up in legislation, constantly. And really, what's it come down to? It comes down to somebody doesn't feel like they have enough transparency or accountability to whatever organization is serving the 911s of their community, needs of their community. And that's fair, right? I can relate to that more than you guys know. But it should be done right. It shouldn't be done at a whim. There should be some accountability for the organization, and there should be accountability for the organization that's being replaced. So government oversight exists, and what we want to do is we just want to make sure that all these organizations have some level of organization, accountability, and transparency. So we can see what their code of ethics are, and we can make the determination that they're adhering to that, right? We're looking for prevention. Government oversight's involved with prevention. Now, some of the most localized government oversight could be just your local government, right? It's my job as a mayor to make sure that the fire and EMS and the police department responds to the calls. If I cut the budget, I have less firefighters. If my city burns down, I'm going to take heat on Fox News. Like, that's the way the system is designed, and that's the way the system is supposed to work. That's the level of accountability. It's the most localized government. But then we have to make sure that we're not misusing other resources. So now there becomes, state guidance and oversight, or federal guidance and oversight, medical director guidance and oversight. All of these things that are designed to make sure that let's say you are a for-profit company. You can't not buy glucagon because it's $100 a pop because you're a for-profit company if the medical director says you have to carry glucagon or the state says you have to carry glucagon. And that's where we talk about the place for this oversight, government regulatory oversight. And it's not just the for-profits. I mean, I've seen many, 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 many not-for-profits in municipal towns that look just to cut corners and cut costs. I remember I had an argument one time with a good friend of mine who runs a service, and he was all excited about the measure and inject epinephrine for EMTs. And I'm all for EMTs being able to measure and inject. But if you look at the medication dosage errors that happen in major hospitals every day, where registered nurses are administering medications every day and should be the best at it under controlled conditions, it's not a very easy skill to get proficient at. And so my thought was, if it's really where you're going to cut costs is between the cost of a $185 generic EpiPen and a measured dose, how much epi are you giving, and does it make a big difference? Maybe you are, and maybe it does make a big difference, right? But if you're not juicing up EpiPens at twice a month, and you've got 4 or 5 units that are operating in your community, is it worth the savings of that, right? And again, maybe it is, but those are the reason that the government gets involved, because the government could turn around and say, if the government didn't say you had to carry epinephrine, maybe some nonprofits or profits would say, well, we're not carrying any epinephrine. Right. And so there has to be process, and there has to be things to hold us accountable and quite frankly, keep us honest. Right. We wind up becoming in this ethical dilemma in this future, this future building, this identification of trends, this respect for accountability and transparency for the government. What does it make us? Well, all in sum, it makes you as the manager, as the administrator, the caretaker of the public trust, right? Your job is to ensure that your decisions are ethical, to protect the public. So you're an EMS manager. So, I mean, very, very few EMS management people are not providing a 911 service, whether it's nonprofit or for-profit. You are providing a service where somebody is calling you at least to some percentage of your call volume and expecting you to show up, to expecting your crews to be trained, expecting them to be equipped, expecting them to be in a clean vehicle, and expecting them to get adequate transport to the facility safely. That's a like you deciding to rotate your vehicles through annual maintenance is an ethical decision, right? You deciding to add crews is efficient resource management, which is an ethical decision. You engaging with the community and the stakeholders and determining on what your needs are at a community and whether they can be afforded by you in the best possible way to answer those needs is an ethical decision. So you as the administrator are carrying with you an incredible burden of public trust. And when that goes bad, it goes bad for a long time. I watched this service destroy an incredibly good reputation in a very short period of time because they violated the public trust in multiple different communities. Now they're back on track, and this service is working phenomenally, but it takes a while. There's a moniker that carries with it. So it's very, very important that you understand that that you are the arbiter of that you are carrying this flag. So everything we've talked about in this entire class up until this point as the manager, the QA component, the effective financing and billing practices, the Medicare, adhering to Medicare, which you'll cover more in finance, and not getting jammed up in CMS regulations, following government oversight, such as OSHA regulations and other mandates, ensuring your crews are ethical, ensuring they have appropriate education, ensuring that they're performing good customer service, ensuring that your supervisors are good leaders and budding leaders, ensuring that you have a succession plan for your organization. All of these things boil down to you as the manager being the arbiter of the public's trust in your organization. I hope you found this class somewhat insightful. I understand it is a large amount of work in a very short period of time. I applaud you for getting your degree. I applaud you for taking this step. I'm here to help. I'm local to the state. If you're a state resident, always feel free to reach out if you have any questions or concerns about the advancement of your career, and think I could help point you in the right direction. Thanks again, and it's been a pleasure.